Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Collins. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mr. Collins. How can I assist you today?
Morning, doctor. I've been feeling unwell for the past few days, and I'm starting to get a bit worried. It feels like the flu, but it's more intense than usual. I also heard about bird flu in the news recently, and now I'm concerned that it might be that.
I see. Let's talk about your symptoms first. You mentioned flu-like symptoms. What exactly have you been experiencing?
Well, it started with a fever, and then I got chills and body aches, my throat's sore and I've got a cough. My muscles feel really weak, and I've had a headache that won't go away. What's scaring me is that I'm also short of breath, and I don't usually get that when I have the flu.
Those are definitely concerning symptoms, especially the fever and shortness of breath. Bird flu, or avian influenza, can present in a similar way to regular flu, but it tends to be more severe. Have you been around any birds or poultry recently?
Yes, actually. I help out on a friend's farm on weekends. They have chickens, and last week, we were clearing out one of the coops. I didn't think much of it until I started feeling sick. Could that have something to do with it?
It's possible. Bird flu is primarily spread from infected birds to humans, often through contact with their droppings, saliva, or other secretions. If the birds were infected, there's a chance you could have been exposed. Were there any signs that the chickens were unwell?
A few of them had died recently, but my friend said it was just because of the cold weather. I didn't think to ask more questions.
That's important information. Birds infected with avian influenza can appear lethargic or stop eating, and sudden death in chickens can sometimes be a sign of infection. The fact that you've had contact with potentially infected birds raises concern. We should definitely consider testing for bird flu. In the meantime, let's talk a bit more about your symptoms and your condition.
What kind of test would you need to do?
We'll need to do a nasal or throat swab to test for the avian flu virus. It's similar to a test for regular flu or COVID-19. The sooner we identify whether it's bird flu or another type of infection, the sooner we can start treatment. We may also run a blood test to check for antibodies, which can help confirm the diagnosis if needed. Have you been in contact with anyone else since you started feeling unwell?
Yeah, my wife and kids at home. They haven't shown any symptoms, but now I'm worried I might have passed something on to them.
That's understandable. Bird flu doesn't spread as easily from person to person as regular flu or other respiratory illnesses, but it's still important to be cautious. I recommend you isolate yourself from your family as much as possible, until we know for sure what's causing your symptoms. Good hygiene practices like regular hand washing and wearing a mask can also help minimize the risk of transmission.
That makes sense. How serious is bird flu? I've heard it can be dangerous.
Bird flu can be very serious, especially if it's not treated early. The strain of the virus that infects humans tends to cause more severe illness than seasonal flu. In some cases, it can lead to complications like pneumonia, acute respiratory distress, or even organ failure. However, if it's caught early, antiviral medications like oseltamivir or zanamivir can help reduce the severity and duration of the illness. That's why getting tested and starting treatment as soon as possible is crucial.
I didn't realize it could get that bad. How long would the treatment take?
If we confirm bird flu, you'll typically need to take antiviral medication for about 5 to 7 days. Most people start to feel better within a week, but it depends on how early treatment begins and the severity of the infection. Some patients may need hospitalization if their symptoms worsen, especially if they develop breathing difficulties or secondary infections like pneumonia. Given that you've mentioned shortness of breath, I'll keep a close eye on that.
Should I go to the hospital now or wait for the test results?
Right now, based on what you've described, I don't think hospitalization is necessary unless your breathing gets worse or your fever spikes dramatically. However, I do want you to monitor your symptoms closely, especially over the next 24 to 48 hours. If you feel like you're struggling to breathe or your condition deteriorates, don't hesitate to seek immediate medical care. I'll also prescribe you some antiviral medication today as a precaution while we wait for the test results.
That sounds like a good plan. What can I do to prevent this from happening again? Should I stop going to the farm?
You don't necessarily need to stop going to the farm, but there are important precautions you should take if you're around poultry, especially during an outbreak of avian influenza. Wear protective gear, like gloves and a mask, when handling birds or cleaning coops. Wash your hands thoroughly after contact with animals or their droppings, and avoid touching your face while working. It's also a good idea to ensure the birds are regularly checked for signs of illness, and any sick or dead birds should be reported to the authorities immediately. Extract 2. Questions 13 to 24. You hear an infectious disease specialist talking to a patient called Chris. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, please come in. It's Mr. Davis, right?
Yeah, that's me. But you can call me Chris.
Sure, Chris. So, you were referred to me because you're concerned about having swine flu, or what we call H1N1 influenza?
Yeah, exactly. I've been feeling off for a couple of days now, and I'm really worried it could be something serious like that.
I understand. I know it's a concern, especially with everything we hear in the news. Why don't you start by telling me about your symptoms, how long they've been going on, and what exactly you've been experiencing?
Well, it started about 4 days ago. I woke up with a really sore throat and some body aches, but I didn't think too much of it. I just thought it was a regular cold, or maybe I overdid it at the gym. But then the next day, I got a fever, 38.5 degrees Celsius, and I've been super tired ever since. I can barely get out of bed, honestly. My muscles ache, I've got chills, and I'm coughing a lot more now too.
That definitely sounds like flu-like symptoms. You mentioned your fever. Has it stayed that high or has it gone up and down?
It's been up and down. Sometimes it feels like it's getting better, and then a few hours later, the fever spikes again, and I'm shivering. It's like a roller coaster. I've also got a really bad headache that just won't go away.
That's really tough. Have you had any other symptoms, like shortness of breath, nausea, or stomach issues?
No, not really. Mostly just the coughing and the fever. Oh, and my nose has been a little runny, but it's not too bad. I just feel completely wiped out.
I can see how that would be worrying. Before we dive deeper, I'd like to know more about your general health. Have you had the flu before? Any chronic health conditions or anything that might make this situation more complicated?
Well, I've had regular flu before, but this feels worse somehow. I don't have any chronic conditions, though. I'm 32, and I'm generally healthy. I work out a few times a week and eat pretty well, though I do work a desk job, so I'm not super active all day. I'm also up to date on most vaccines, but I didn't get a flu shot this year. Honestly, I didn't think I needed it since I don't usually get sick.
That's helpful information. Not getting the flu shot can increase your risk, especially when we're talking about a strain like H1N1. Have you been around anyone who's had flu-like symptoms recently? Family, co-workers, friends?
Yeah, actually. My co-worker was out sick last week, and he mentioned something about having the flu, but I didn't think too much of it at the time. I guess that could be where I got it from. We work in pretty close quarters, so it's easy to catch something.
That does sound like a possible source of exposure. You're not alone, though. Swine flu tends to spread quickly, especially in closed spaces. It's important to remember that even though it can be more severe than seasonal flu in some cases, most people recover without needing hospitalization. We just have to keep an eye on it, especially because flu viruses can be unpredictable.
Yeah, that's what I'm scared of. I read online that H1N1 was really bad a few years ago, and it killed a lot of people. I don't want to end up in the hospital.
I understand your concern. The H1N1 strain can cause more severe illness, particularly in younger adults like yourself, but it's important not to panic. The strain we're dealing with now is different from the one we saw during the 2009 pandemic. We've learned a lot about how to treat it since then. And there are antiviral medications we can prescribe that can help shorten the duration and severity of the illness if we catch it early enough.
So, you think I might have it, then?
Based on your symptoms and your possible exposure, it's definitely a possibility, but we'll need to do some tests to confirm. We'll take a nasal swab, which will give us a better idea of whether you have H1N1 or another strain of flu. The good news is, you came in early, and if it is swine flu, we can start treatment right away.
That's a relief to hear. I've been so stressed about it. Is there anything I can do in the meantime while waiting for the results?
Yes, definitely. First, make sure you're resting as much as possible. Stay hydrated. Flu can really dehydrate you, especially if you're sweating a lot from the fever. You should also try to stay isolated from others to prevent spreading it, especially since the flu is highly contagious. If the test comes back positive, we'll discuss antivirals. But until then, over-the-counter pain relievers like acetaminophen can help with your fever and aches. Just avoid aspirin because of the risk of complications with viral infections.
I've been taking some ibuprofen and it seems to help a bit. I'll definitely keep staying home. I really don't want anyone else to catch this.
That's the right call. Remember, even if it's not H1N1, flu can still spread quickly. It's good that you're being cautious. Is there anyone at home who might be at higher risk, like kids or elderly relatives?
No, I live alone. But I've been talking to my mom a lot about it, and she's been really worried. She's older, so I've kept my distance.
That's smart. Just keep doing what you're doing. And once we get the test results back, we'll have a clearer idea of the next steps. And of course, if your symptoms get worse, like if you have trouble breathing or your fever doesn't come down, get in touch with us right away or head to the emergency room.
Thanks, I will. I feel a little better knowing there's a plan. I guess I'll just wait for the test results and take it easy.
Exactly. We'll get through this and I'll call you as soon as we have the results. In the meantime, keep an eye on those symptoms and don't hesitate to reach out if you're worried about anything.
Thanks, doctor.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse explaining about a patient to a colleague. Now read the question.
Mrs. Dawson, a 68-year-old patient, has been experiencing persistent shortness of breath and chest discomfort for the past several hours. She has a known medical history of hypertension and type 2 diabetes. Earlier today, she became unwell following some light physical activity, which seemed to trigger these symptoms. Upon our arrival, she was sweating profusely and appeared visibly anxious, likely due to the discomfort she was feeling. My colleague performed an ECG, and the results showed some irregularities that raised concern. We've already administered aspirin to help prevent any potential clotting, which could exacerbate her condition. Although her vital signs are stable at the moment, she's still experiencing discomfort. We've reached out to her daughter, who is currently on her way to the hospital, as I believe her presence could help alleviate some of Mrs. Dawson's anxiety. She seems very worried about what's happening. In the meantime, we've provided oxygen to assist with her breathing and are closely monitoring her for any signs of deterioration. We've also kept her seated upright to ease her breathing and keep her as comfortable as possible.
Now look at question 26. You hear a discussion between a doctor and nurse. Now read the question.
Asthma, but this episode feels significantly more intense than what she typically experiences. Sarah has already used her inhaler twice since arriving here, but unfortunately, it hasn't provided any noticeable relief this time. Normally, her inhaler works within about 10 minutes, and she's able to breathe normally again, but today, her breathing remains very labored. Her oxygen saturation levels are also dropping at a concerning rate, which is quite unusual for her.
I see. Considering the situation and the fact that her inhaler hasn't been effective, do you think it's time to initiate a nebulizer treatment? That should help open up her airways and improve her oxygen levels more effectively than the inhaler.
Yes, I believe that would be the best course of action at this point. We need to stabilize her breathing as quickly as possible before the situation deteriorates further and becomes critical.
Now look at question 27. You hear a nurse discussing about Mr. Stevens. Now read the question. Sorry to interrupt you, Dr. Taylor. I just needed a moment to quickly discuss Mr. Stevens' current blood pressure medication with you. It's regarding the prescription of lisinopril that you started him on last week to help manage his hypertension.
Oh, right. For his hypertension. How has he been responding to it so far?
Well, he's been taking 10 milligram tablets of lisinopril daily for the past week as prescribed. However, He came by today saying that he's been feeling somewhat lightheaded and dizzy, which has been a concern for him. In addition, he's also been complaining of a persistent dry cough that's developed since he started the medication.
Those symptoms are not unusual with lisinopril. The dry cough is a known side effect, and lightheadedness can occur as well, though it typically subsides after a while. However, if these side effects are bothering him, especially the dizziness, we might need to reconsider his treatment plan.
Now look at question 28. You hear a tutor's explanation to a student. Now read the question.
Let's go over the symptoms for Mr. Evans in room 4.
Sure, I wasn't entirely confident on this one. He's got a persistent cough and fatigue, but it's not going to be something like pneumonia, right?
It's possible, but given his history and lack of fever, it's not very likely. So, what else might explain those symptoms? Think of something more typical for a patient like him.
Well, he's a smoker, and he mentioned feeling short of breath recently, especially after climbing stairs.
Right, good. And what's something common that can affect the lungs and causes this?
Maybe coughed.
Exactly. Chronic obstructive pulmonary disease is much more likely here, given his smoking history and progressive symptoms. Any other thoughts?
Maybe asthma, but his symptoms seem more long-term.
Exactly. COPD is more likely, given the chronic nature of his condition.
Now look at question 29. You hear a medical professional explaining a new monitoring device. Now read the question.
Thank you all for being here. After thorough review, the clinic has decided to implement a new type of monitoring device for patients with chronic respiratory conditions, particularly those with asthma or COPD. Currently, we rely on peak flow meters to measure lung function, which, while effective, require regular manual effort and can be less precise over time. This new device is a digital spirometer that automatically tracks lung function. It provides more accurate readings by measuring the volume and speed of air the patient exhales. In fact, it's Bluetooth-enabled and syncs with the patient's smartphone, allowing real-time monitoring and data sharing with healthcare providers. Although the cost of the device is higher than peak flow meters, its accuracy and ease of use make it a more valuable tool in managing chronic respiratory conditions. Given these benefits, we believe this digital spirometer will greatly enhance patient care and monitoring outcomes.
Now look at question 30. You hear pharmacists talking about medication review. Now read the question.
Review process going for the new diabetic patients?
Well, it's been going well overall. We've managed to get through most of the patient reviews, and the new software we've been using is a big help. However, I'm struggling to find a consistent supply of the insulin pens we usually prescribe. There's been a bit of a delay in the shipments recently, and I'm worried it could affect some of our patients who need them urgently. Have you had any similar issues with suppliers?
Yes, I've heard about that. It's important that we keep things running smoothly for those patients. I'll check with a few other suppliers I've used in the past and see if we can get some stock in quickly.
That would be great, thank you.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor talking about immunodeficiency. You now have 90 seconds to read questions.
Hello everyone, I'm Dr. Samantha Miller, and today I'll be talking about a subject that's often misunderstood, primary immunodeficiency PI. This term refers to a group of more than 400 rare chronic disorders in which part of the body's immune system is missing or functions improperly. While often diagnosed in children, primary immunodeficiencies can occur in adults as well, and their prevalence is often underestimated due to lack of awareness among healthcare professionals. Primary immunodeficiency disorders are not caused by lifestyle factors or infections. They are largely genetic, meaning they are inherited. People with PI are more susceptible to frequent, severe, or unusual infections that can be difficult to treat. Despite the significant advancements in diagnosing and managing PI, these conditions remain a challenge due to their varied presentation, with some patients experiencing only mild symptoms while others suffer from life-threatening infections. As a result, understanding and managing these disorders require a nuanced approach from clinicians. One of the biggest challenges in managing primary immunodeficiency is the delay in diagnosis. Patients with PI often endure a prolonged diagnostic journey involving multiple healthcare providers before receiving an accurate diagnosis. Many of these individuals are initially misdiagnosed with more common conditions, such as asthma, allergies, or chronic sinusitis. This leads to questions such as, why aren't these infections responding to standard treatments, and could this be something more serious? These delays not only increase the risk of complications but also significantly impact the quality of life of those affected. Recent studies highlight the importance of early diagnosis and treatment. In a recent publication in the Journal of Clinical Immunology, researchers found that patients diagnosed early with PI and treated appropriately had markedly better outcomes compared to those who were diagnosed later in the course of their disease. The study reviewed cases of over 500 individuals with various types of PI and demonstrated that early intervention with treatments like immunoglobulin replacement therapy significantly reduced infection rates, improved lung function, and enhanced overall quality of life. However, the treatment of PI is not without its challenges. Immunoglobulin therapy, which is one of the primary treatments, can be burdensome due to the frequent need for infusions, which can be administered intravenously or subcutaneously. Patients may experience side effects such as headaches, fatigue, and allergic reactions. Despite these drawbacks, most patients and clinicians agree that the benefits of treatment, including fewer infections and hospitalizations, outweigh these inconveniences. Another issue that often goes unnoticed is the psychological impact of living with PI. Patients with these disorders frequently experience anxiety and depression, stemming from the chronic nature of their condition and the constant fear of infections. This psychological burden underscores the need for comprehensive care that includes not only medical treatment but also mental health support. Healthcare providers must also be vigilant about recognizing the early signs of PI, especially in patients with a history of recurrent infections, family history of PI, or infections that are unusually severe or resistant to treatment. Educational efforts targeting both clinicians and the public are crucial to improve early detection rates and ensure that patients receive the care they need as soon as possible. The good news is that advances in genetic testing and a better understanding of these disorders have made it possible to identify many forms of PI more quickly and accurately than ever before. This has led to personalized treatment plans that are tailored to the specific type of immunodeficiency, allowing patients to manage their condition more effectively. In conclusion, primary immunodeficiency is a complex and often overlooked condition that requires a coordinated approach to diagnosis and treatment. The key to improving outcomes lies in increasing awareness among healthcare providers, ensuring timely diagnosis, and providing comprehensive care that addresses both the physical and psychological aspects of the disorder. By doing so, we can offer hope and a better quality of life to those living with these challenging conditions.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Mark Jennings discussing stomach cancer. Now, read the questions. You now have 90 seconds to read questions. Today, we're discussing a highly critical health topic with oncologist Dr. Mark Jennings, stomach cancer. Dr. Jennings, why does stomach cancer remain one of the most challenging cancers to treat? And could you provide us with a brief history of its treatment?
You're absolutely right. Stomach cancer is notoriously difficult to treat, and this has been true for decades. New research conducted across several international cancer institutes suggests that one of the main reasons for its challenging nature is the difficulty of early detection. Stomach cancer often goes undetected until it's in advanced stages. primarily because the symptoms are either nonspecific or mistaken for less severe conditions. Historically, in the 1970s, when screening wasn't as advanced, most patients were diagnosed too late for effective intervention. Back then, surgery was the only real option, but the survival rates were very low. It wasn't until the development of more advanced chemotherapy drugs and targeted therapies in the late 1990s that we started to see some improvement, but even then, challenges remained.
Can you tell us more about those challenges?
One significant issue is that the stomach is located deep within the body, surrounded by other organs, making it difficult to access without invasive procedures. Because of this, tumors can grow quite large before they cause noticeable symptoms. In addition, the cancer can easily spread to nearby lymph nodes and other organs, further complicating treatment options. Even today, when we have advanced imaging techniques, pinpointing the exact stage of the cancer and deciding on the best treatment approach can still be quite complex.
What are the main symptoms to look out for?
Well, common symptoms include persistent indigestion, a feeling of fullness even after small meals, and unintentional weight loss. Unfortunately, these are often attributed to benign conditions, like ulcers or gastritis, so many patients delay seeking medical advice. That delay can be critical. In the early stages, when the cancer is most treatable, it often presents no symptoms at all, or ones that are so mild that they're easily dismissed.
How have treatment methods evolved over the years?
Treatment has come a long way since the days of solely relying on surgery. In the 1980s and 1990s, we started using chemotherapy more routinely, and it was often used in combination with surgery to try and reduce tumor size before removing it. Then came the introduction of targeted therapies, which attack specific proteins involved in cancer growth. These treatments have improved outcomes somewhat, but stomach cancer remains a complex and aggressive disease. Today, there's also a push towards immunotherapy, which aims to help the body's own immune system fight the cancer. However, the response rates for stomach cancer are still not as high as we'd like them to be.
What's the current outlook for patients diagnosed today?
The outlook largely depends on the stage of diagnosis. For early-stage cancers, the 5-year survival rate can be over 70%. But unfortunately, because early detection is so rare, many patients present at a much later stage, where survival rates drop significantly. It's one of the reasons why we advocate for people at higher risk, those with family history or certain genetic markers, to undergo regular screenings. Advances in personalized medicine are helping tailor treatments to individual patients, but we're still a long way from where we need to be.
What do you see as the next steps in the fight against stomach cancer?
I think a lot of hope lies in improving early detection methods, developing non-invasive tests, such as blood markers or breath tests that can reliably identify early cancer, could be a game changer. There's also a great deal of research into better understanding the genetic factors involved, which could help in creating more effective, individualized treatments. We need to keep pushing forward with research and making sure that patients have access to the latest treatments and clinical trials. The journey is slow, but we're making progress.
That is the end of Part C. You now have 2 minutes to check your answers.